We are very fortunate to be located in a community hospital where we attract patients for treatment who live here. Our staff reflects the diversity of our neighborhood, both culturally and linguistically, so that we can be confident in offering culturally sensitive treatment to people from all backgrounds. So we have connections with agencies in the community that refer to us, including nursing homes, adult homes, and clinics. We offer emergency consultation, inpatient services on 2 units, and then we can refer to our own outpatient clinic to make sure that patients are cared for throughout the continuum of care at every stage of their illness.
I am Amjad Hindi. I am the psychiatrist and director of Minkin 5, which is the adult inpatient unit here at Kingsbrook. I not only act as the physician for patients, but I also am the leader of the team, the multidisciplinary team that we use for the care of patients, and we meet daily about this. What happens typically in an inpatient unit like ours is that the patient gets to speak to different clinicians and who provide in the end different clinical insights, and they get integrated together every morning in team rounds where it's a multidiscipline round, everybody's sitting down on the same table and discussing the patient. And this culminates in the end with the formation of what is called the treatment plan, which the patient then is part of the multidisciplinary team, and the patient gets to participate in deciding what are the goals of their care. And that idea allows for us to cover all the possible clinical bases and be able to address not just the medical symptom, but rather the person as a whole, which is what we need to do.
My name is Adrienne Figueiredo. I'm an activity therapist on Minkin 5. All day long, as a team, we run activity therapy groups. They're psychotherapy-based groups. So we have a pretty wide variety. We have art therapy groups, music groups, creative writing groups, stretching, exercise, meditation groups, pretty wide range.
My name is Jeanette Marin. I'm an activity therapist on Minkin 5. These activity groups are so important to patients because they're also helping patients be able to express themselves creatively in both nonverbal and verbal forms.
In Kingsbrook Jewish Hospital, this is the first hospital who had a unit for geriatric psychiatry patients. So I had my specialty training in geriatric psychiatry, so I was looking for a place where I can just deal with the geriatric psychiatry patients. So I decided to come here. My parents are elderly, they have problems, so it's like taking care of my parents. I love my job.
It's very interesting because we have a very diverse population coming from the Caribbean and from other countries. And when we're able to speak their language or to understand their cultural background, this makes their treatment easier.
My goal as a nurse in the psychiatric setting is to understand the patients, for the patients to feel that I'm compassionate towards them, that I have empathy, that I understand the situation that they're in. And I want to be there every day so I can help them.
In addition to the clinical care we provide through our affiliation with SUNY Downstate Medical School, we have an academic connection with medical students, residents, and faculty members who are also our attending psychiatrists to provide the very most current psychiatric treatment to all our patients. We have a single phone number that people can call from any outside agency, be it a nursing home, an adult home, a clinic. They can call and make contact with our staff to make referrals to our hospital or to our clinic. In addition, there's a 24-hour phone number at Kingsbrook Jewish Medical Center where people can call if the situation is less urgent to make an outpatient appointment. And of course, we have 24-hour consultations available to the emergency department in case of a true emergency.